Do we need a roll call or can you just tell who's here?
Yeah, I have it marked down.
Okay. Can I get a motion to approve the agenda?
Go ahead.
For agenda.
I'll second.
Any objection? Okay, then we'll accept the agenda. Is there anyone online who would like to speak to the committee? Okay, we'll move on from there. How about the minutes? Did anybody else read the minutes? I read the minutes, so if you approve the minutes.
I'll second.
Okay, is there no objection? If there's no objection, we'll accept those. Old business. Old business, so let's move on to new business. We have the audit report from Joe.
Yes, so the Medicaid 2022 audit report is actually, should say 2021 audit report. Sorry about that. So what that is the claims audit, just making forms on an annual basis based on the claims being given. So for 2021 claims, which they requested this spring, they pulled 90 different claims, 45 outpatient, 45 inpatient. They look at it in two separate buckets as to how they, there's strata A and strata B. The strata A is the outpatient claims, so we had 45 claims looked at. There were 7 of them that had issues of payment. And so we've been overpaid $3,000 on those 45 claims over that period of time, based on insufficient documentation to support the service that's provided. That was the predominant reason. On the inpatient claims, there was 1 out of the 45, and it was actually $60, $70. It was like one particular charge, so it was a very small. But what they do on the outpatient side is they take that dollar amount, extrapolate it over the population, and then apply it to all your payments over the years. So it's never it's generated. Take back funds based on that. So in June, we had to pay back $176,000 to Medicaid for this overpayment.
Excuse me, how many do they look at? What's the
They'll get 45 outpatient and 45 inpatient.
45 out of town?
1,000. And so we, like the total claims volume, there was like $90,000 in claims to look at, over $18 million in claims. I think was the total population. I know the dollars, and it wasn't looking at the claims.
So they extrapolated it based on dollar amount or claim number?
Dollar amount, and then assigned up to the. So we've looked at the issues. We've actually talked to some of the departments that were involved to make sure it's not a recurring issue.
Was there one department in particular, for instance, PT or OT or something?
Yeah, so PT and OT had the predominance of the claims. Most of the dollars were associated with PT and OT claims. There's also a handful of COVID claims in there. Yeah. Like the tested methodology we use the CFID versus Cepheid versus just the swabs, I guess. Like that. So there's a few of those in there you can decide. See, this type of, there's not a lot we can do. It's just report and then pay the money back.
And if I may add, they do that on the private side too. They do that to me. And then even the private insurers do that for me, the Blue Crosses and the HANAs, they ask for funds. I've never had a problem because I tend to undergo, but do the private?
That's what I've seen. I think we were asking me. I know Medicare will use some claims.
Just taking note, can you rank how much money you were paying?
$176,000.
And was that, was that just the outpatient or that?
That's total.
Thanks. Any other questions? So, okay. No other questions on that. We're ready to move on to Gail.
All right. Well, I have, this is going to be an action item, so I have 2 policies up for your review. Both of these have board components in them, so that's why they are up to the board level. So The first one was so the action item here is for the compliance education and training policy and our code of conduct policy. So both of those, I put red lines in your packet for you to review so you could see the changes in them on it. The code of conduct policy, there was a small amount of changes on it, and the other part of the code of conduct, I did include a draft of the new handbook on that, so you can see what that would look like for the employees. The education policy, there were some significant changes. I want to take thank you out to Hal for helping Words craft that and address some of the changes in that weren't incongruent with the board bylaws. So we put that policy is more in line with the board bylaws on the education for the board. So if there's any questions on either of those, I can entertain questions. Yes.
Okay, well, I think I had a crack at this before, but when I went through it very carefully, the compliance policy, I do have some problems with several things. In regulatory wording, the word should is used when you're giving advice, and it's not a word that requires anyone to do anything. The word must and the word shall denote an obligation. You must do this. That's completely different than you should or you may. The word may is for discretionary action. So as I went through more carefully, I found the word should in a number of places that I think are not really what we intend in our policy. And then I've got a whole list of these, and maybe we should go through those one by one. That's one thing. Another thing that I found really troubling is the policy makes it very clear that a hospital employee can't give any information to a competitor. And so that's really clear in the case of, say, a bid that's going out for some construction. But then I started thinking about that, and I started thinking, well, wait a minute. What if somebody from search calls and wants to know what it costs to get an MRI? That should be publicly available information, but the policy seems to be telling an employee you can't release that because the person on the other end of the line is their competitor. So I don't think that's really what we want to be saying. I think we need to distinguish between proprietary information and publicly available information. Let's see. The policy would seem to also be telling employees they can't inquire from a competitor. So for example, if somebody needs an MRI of their knee, this would seem to be saying you can't call Juno Bonner Joint Search and find out what an MRI would cost over there. So we'll look at those in a little bit more detail. Also, I thought we should talk a little bit about fundraising. I've been thinking about the workplaces that I've been in, the number of workplaces. It's common for parents who have kids with Girl Scout cookies to sort of have that available or have some kind of transaction involving Girl Scout cookies or maybe raffles for high school travel. This seems to say that's absolutely not allowed.
We're not supposed to.
Oh, okay. Well, I thought we should at least think about that. And then I do have some punctuation issues. I hate to bring that up. The compliance dependent is both in caps and not capitalized. In what page is that? Well, there's a page where there's just inconsistency. But I think let's look at these words should, if that would be if people would be willing to put up with that. Look at the word should in a number of places. And see if what we mean is you should, it's just advice, or whether we're trying to tell people, no, you cannot do this, or you absolutely must report this violation of somebody. If we're dealing with somebody misusing controlled substances, we don't mean to tell people you should report that. I mean, I'm not sure that that's one in there, but that illustrates. So let's see, on the fifth paragraph, on the first page, what do we have? 1, 2, 3, 4. Not sure where that is. Paragraph, first page, 1, 2, 3, 4, 5. All hospital employees,
He's in the code of
contractors, or
conduct.
professors enjoy professional. Question should be presented to a supervisor, human resources, or the compliance officer. The final paragraph of that.
Now, which page are you on?
I'm on the first page of the compliance policy, and I'm looking at it in Adobe. It doesn't have page number.
He's in
At
the,
the bottom. Should be a page.
No, there's no.
he's in a different one. He's in the code of nope, go back up. You're on the code of conduct policy. Okay, right there.
Yeah, go up and then go to the paragraph that starts with all employees. And then look at the last sentence there. Question should be presented to a supervisor. Is should the word we want there?
That's a good question, because it does look like if it's inquisitive, like questioning, like, hey, is this, then I guess you could be should. If something is egregious or serious, then shall is what we should put. But I'm not sure about it. That's about. We have read, I do remember reading a lot of should.
Well, anyway, I'll direct that to staff. What is the intent here? Is the intent to require people who see a violation of ethical standards to report this? And if so, the questions must be presented. The word must is the correct word. And if should is the word, then we can forward that on to the rest of the board. So, if that's okay with everybody else.
So, Mr. Chair, so you're looking at the all hospital employees and contractors. Is this the,
I'm looking at the last sentence in that
Yes.
paragraph. Question should be presented to supervisor, human resources, or compliance officer. If the intent is to require them to do one of these things, then the word should is inappropriate.
so I think the sentence questions is not, it's not saying violations. So it's asking that if you have questions regarding this, then you should present them to relating to this. So it's not asking about violations.
Okay, then that one's fine. Nobody else has anything more to say about that. Let's go to the next paragraph. All employees should review this code of conduct, attend mandatory training, and sign a certification and agreement of compliance statement. This one seems less ambiguous.
Yes, I agree with that. I can change that to must.
That's the will.
Will, yeah, will.
Well,
Okay. Third paragraph, third page. Let's see what we have there. Hospital employees may be employed, hospital employees may not be employed. Employees should not have other outside employment business interests in place. Place them in a position of appearing. You see what I mean? On the go down 3 pages, there's some little matters there that are bulleted with lowercase Roman numerals. Okay, all right, stop right there. And then go right above the Roman numerals. Employees should not have other outside employment or business interests that place them in position. And so on and so forth. Employees should not have other.
I have insert may, but they're
Yeah,
in there, may not.
because, if I may, In terms of physicians, you've got Valley Medical and somebody in their practice may be a hospitalist, but yet Valley Medical has ultrasound that is providing a good service that is provided at the hospital. So that could be problematic if it was a must.
Okay. We're fine with that one?
I've seen in situations like this where it's a required disclosure that you have.
CBJ legal, any outside employment, we have to disclose it to HR and it goes to CBJ legal every year.
Right, so that should cover, in this particular instance, if our policy is that it could be may, or just say in the event that, something to the effect of in the event that an employee has other employment, it must be disclosed and approved or determined that it doesn't violate the conflict of interest, more this code of conduct policy.
Yes, I agree. I think that we want to allow these things, but right now it's not clear what the intent is. I think it needs to be, hospital employees may not be employed, so on and so forth, have an independent business. They need the hospital provider supervision without disclosure to the human resources. So, okay, so that's good. And then this should here, I think that wording could be improved. But I think right now, I think we agree should is the appropriate word, but it's not clear.
So is there somewhere else in here that secondary employment is addressed?
We have a separate policy, an internal policy that addresses that. So,
Could you word it as employees must also disclose to Barla that if they have employment or business interest that place them in a position, blah, 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 during the. So you could force them to disclose if it's even close to the appearance of.
I think that's what the intent should be. That if there's any question,
Employees
disclose it.
must disclose if they have other outside employment, business interests that place them in a position of appearing.
Okay, is the committee happy with that wording, that change? Okay, could we go down to the next to the paragraph under billing and claims? Any false, inaccurate, or questionable claim should be reported immediately to the supervisor or the compliance officer. I think this is one of the clearest.
Yeah, that's the.
This is one of the clearest examples of where should's the wrong. Okay,
Versus will, or what's the other word? If it's not should, it's must.
must, will, something that denotes a requirement instead of just advisory. Okay. So if we go to the next page, there's some bulleted statements, and the last one is hospitals. The hospital carefully follows Medicare rules and assignments, and so on and so forth. On behalf of the decision, the question should be directed to the compliance officer or the director of patient financial services.
We change that to must.
Yeah, I'm comfortable with it being should. I mean, if there's a question,
Yeah, if it's a question, it's just where.
you want to know where, this is the person you talk to,
Yeah.
you should talk to this
Okay.
person.
Okay, then, page 4, here's another one that looks correct. Second full paragraph. What is it? Hospital employees should avoid oral or written communication. Oh, it looks correct, but I don't think it has the right, I think the meaning's wrong. Hospital employees should, I'm on the next page under discounts, or discounts with competitors. Hospital employees should avoid oral or written communication with any competitor about pricing policies, pricing formulas, bids, bid formulas concerning discounts, credit arrangements, related terms of sales service. Okay, there are cases where people have proprietary information and they absolutely should not release that. There are those cases. For example, bids for contracting for construction. But there's other cases where hospital employees are dealing with publicly available information, and there's no reason for them to not exchange that with any member of the public or any business that calls and asks.
So I guess my question is, what is considered? Not everything that we do will fall under the umbrella of public information. I mean, clearly, protected information doesn't, but there are a lot of other things that doesn't necessarily fall under public information that can be classified as my inclination is to, if it's public information, refer them to the public place that they can get it, that information, and not provide it unless there's a release of information or some other valid reason. I mean,
Well, what if I call and I say, I was told I should have get an MRI of my knee. What would that cost? Should there be a big process?
you're not a competitor.
Yeah, but how would the person know? What if I did work for Search in the contracting department and the person I'm talking to knows that? And I'm calling to say my orthopedic surgeon suggests I get an MRI of my knee. What does it cost there at the hospital?
We don't publish our charge master. We do.
Yeah.
You should.
It's federal law.
That's right. That's
County
right.
22.
But what they pay is based upon the insurance and the,
Well,
deductible.
so I would try not to get into that at all.
But even what Ian's saying, a lot of the payments from a lot of contracts, a lot of that information is publicly available too, it's posted.
I don't think as a matter of policy, we should be telling people to not disclose publicly available information.
I also think that it would be challenging for an employee that's an intake person to try to discern what's publicly available and what's not. So just add a bullet point that says, if this information could be considered public information, please direct the query to the appropriate department, so that public policy goes to, that, and or billing goes to billing. So that you can divert it to somebody, to the appropriate party. The billing people, they all know that. I mean, they know the policies, what they can disclose and what they can't. They should. But, the clerk at the end of the line might not know.
I mean, what I also don't want to do, and I doubt that we'll be able to solve this right here, but I don't want to put our employees who are asked that question in a position where they give an answer that they believe is correct, but it's not what somebody was asking for, and they're disappointed. Now, this relates to competitors, specifically to competitors, but I would suggest that we refer to identify which is considered proprietary information in here, and then everything else should be referred to where we've got it posted. Where that public information is posted. That would be my recommendation.
And just, this is just a general overview. A lot of this is handled in your training and orientation of where you're working in your areas. You know, this is just a very general, broad overview of a contact. And then if you're working in an accounting area, you have a more in-depth understanding of what your job is and what information is shared and what isn't shared. Or if you work in IT or other areas, you understand what is shareable and what isn't. You know, this is,
But it is policy. It should have only one meeting. The meeting should be clear in every single instance when we're telling people this is the policy. And maybe it's clear to the people. I don't want to belabor these things. Just wanted to flag that there's a certain carelessness with the way the word shall is being used. And I wanted people to read it and say, oh, okay, I see what that means, and then move on. I don't want to get stuck. But if there are places, and I've identified at least one, where that's the wrong word for a policy. And maybe there's some more. Page 5. Antitrust, third full paragraph. 2, 3. That's the one we just looked at. Page 6, waste disposal. What do we have on waste disposal? Hospital complies with Clean Air Act, Resource Conservation Recovery Act, and federal regulation governing so on and so forth. If employee suspects non-compliance or violation of these, the circumstances should be reported to us. So this is advisory. Is that our intent, or do we want to require reporting in this case? I thought this was, from context, I thought this is a case where shall is the wrong word. Or should is the wrong word. Should is the wrong word.
I would agree. That would be better as must or will. It's a violation, clearly a violation of the law.
Any other comments? Move on. Privacy and security. What do we have over there? We used. Okay, hospital employees may only use disclosed. Okay, so that one's clear. When no employee is permitted to access medical records. Employees should not discuss patients outside the hospital or with families. I think that's another case where it's more than, it should be more than a recommendation. But employees must not discuss patients outside or similar.
That seems reasonable.
okay. I mean, I can take, I'm just looking up the word should, and it used to indicate obligation, duty, or correctness. So I can go through and change all the shoulds.
Should in regulatory language?
It's in the Oxford Language Dictionary, so I can go through and change the shoulds to must or will, and change it all in the code of conduct if that's what the committee prefers, a different word
I guess
to make it more clear for
yeah,
you.
I think it's a sunny day. We all want to get outside. I think
Yeah.
at this point, what I would like to do is go look at every single case with the word should is in there, and ask yourself, is that what we mean? And if that's not what you mean, let's change it. And then we'll send the changed version onto the full board.
I agree, and broadly, questions should be directed, something like that, but violations must be, or these hard rules cannot talk about. medical records outside. I think that's a must and will that, and I bet you'll be able to flip those, Gail.
Sure. I'm happy to change it and make it a stronger word.
That must be the other.
It's up a couple pages.
Pardon?
It's up a couple pages.
Oh, start law. Let's look at that. Let's look at the last sentence because this illustrates something I just feel like I've gone on and on too much about already. Hospital employees should review applicable hospital policies and or discuss proposed payments for gifting activities and so on and so forth. Okay, so and means you must do both of these things. Or means you need to do one or the other or both, at least one. And they have completely different meanings here. So if you have to do both, that's one thing. If you only need to do one, that's another thing. And since this is a policy, the author needs to be telling the reader whether and is the correct word or is the correct word.
I missed it. I thought I got all the ands and orders out of them.
I
I
think,
went on a search and destroy on the policy and I missed one.
I think in no case should and/or be used as a conjunction in a policy. Because and or and not logical operators that tell the reader what it means. But the word should is also worth looking at here too. Hospital employees should review applicable policies and or discuss any proposed payments. So if you look at this and make a logic diagram, well then anything, if the hospital employee doesn't do either one of those, then the hospital employee is still good. If the hospital does one and not the other, the hospital employee is still good. But maybe we want the hospital employee to do both. And so the logic's got to be there so that that meaning is clear. And I don't know what the meaning is. So what is the meaning? Should hospital employees be required to do both, or just sort of advising them to do one or the other or both? So I'm asking, what is the intent there?
Yeah,
Would you suspect it's must then and
I would agree with you, Dr. Esther.
must review applicable, if they're gonna do it, you gotta get it cleared and discuss any payments or gifts, which is can't come up with the same thing.
Yes,
Must and then.
Dr. Esther.
And so I think that's the way I thought the intent was. You must do both things. Is that the intent?
Yes,
To do both. So then the word is.
yes.
So, okay, I don't want to go on any more about that, but, or does anybody?
No, I agree. I think that's good pickup.
Okay.
That's why you're the head of compliance.
well, clarity is important, so appreciate it.
Anything more to say?
Nothing more to say.
Okay, so where are we? Yeah. So that is the code of conduct. Where are we in the education policy?
Is there any other?
Anybody else review the education policy?
I didn't make it all the way through.
I did. I read everything, but
I don't think there's an and or that is not deleted in that one.
You know, and I can say I checked. And I don't think I missed it.
that's a good sign.
All right.
I'm not sure about a should though. I might need to go back and look at that one again.
Hospital, I'm the wrong policy now. But I think that,
Is that the one where you remove the quarterly obligation in the red line? Okay, yeah, that was nice. If it's not federal law, then get rid of it.
I will say the handbook is the one that I did right from scratch, so.
yes, we'll get to that in a minute. Should we move on to talk about the handbook then? Well, as I said to you, when nobody else was, or very few people were in here, I found this handbook very well written, very clear, nice simple sentences. And
And I think the intent of the author was to write it at a certain educational level so it can be easily understood from the janitor all the way up to the doctor.
Get a good preface by the CEO. Thank you.
That's good.
Can I ask a question about the discrimination section? I think there's a couple spots where it's.
Okay.
um, So it doesn't happen often, but often enough that if a handbook is going to be compliant with federal law, I know the intent was to write it at a certain educational level, but at some point, the protected classes tend to change. So if there's a reference to the specific law in there or any other protected class as identified by, that'll cover our tail in the event that the protected classes change between the time that this is written and the time that we distributed the policy.
Excuse me, where is that?
Well, I might be in a different spot.
I might have Chad
Oh, is it
double check that. I know he
Is it
did
in-
read it.
equal opportunity diversity?
Yes,
Yeah.
That's right. So you're suggesting add any other protected class?
yes.
Is that simple to do?
We can add that.
Yeah, protected classes defined by the federal government.
Exactly, and it changes it. The wording of the existing protected classes sometimes changes. The definition of it sometimes changes, as well as additions to the protected classes.
Okay,
So
good catch.
that would be a CYA for us.
You want to align that, so the state's definition is different than the federal definition. The
Is it?
state's definition is actually a little bit broader,
Oh.
has been historically, so just let us know what you want to align it to, state or the federal, or
Whichever
The broadest.
CBG code is even tighter than that, so I would reference.
has more protected classes. Whichever covers the broadest most.
Or you could just say by applicable law.
That's again. That's as well. Whichever language we use, just make sure that applicable federal, state, and local laws.
Okay, are there any other thoughts or comments? Are we ready to move on to Nathan's transition contract review? Presentation.
Because we had a motion. Or is this?
Oh, yes, we need to, yes, sorry, thank you. We need to move to forward these on to the full board.
Pages,
That's altered with
Subject to editorial,
With,
editorial changes or clarifications.
could we make the motion with editorial changes as approved by the chair prior to the board?
Well, we could do that. Or we
Yes.
could just say, subject to editorial revision. I'll be glad to look at it again.
Thank you, sir.
I move the board compliance and audit committee at Bartlett Regional Hospital approve the updated compliance, education and training policy and code of conduct policy as amended.
Subject to editorial change.
Subject to editorial.
Perfect, sounds good.
Okay, are there any objections? Okay, now we're ready to move on. I apologize for skipping over that important part of the meeting.
Is there a second for that motion?
Yes,
Thank you.
Thanks for keeping us on track there.
Yeah.
Okay, we ready?
Okay, well, as part of the leadership's initiative to capture a lot of the strategies that and initiatives that have been put forward by a lot of the departments, the compliance A3 that we put together has been to create a compliance plan and evaluation for physician and vendor contracts. I think in the agenda, it just said physician contracts, but this is intended for all contracts. Initially, we have created, Bartlett now has a physician contract committee that's reviewing physician contracts and the process behind how contracts get reviewed. The intent of this A3 and goal is to make sure that there is compliance elements baked into that process so that when you get, your check boxes going and you go from, step 1 to step 2, maybe step 6 becomes, okay, now we need to have a review to make sure all of the compliance elements that affect this particular contract are reviewed as part of that process to move it forward. The idea also is to have this same process baked into other non-physician contracts as well, because they also have compliance elements that are needed or required in order for it to be compliant as well. Any questions?
Well, could you just briefly tell us what is done in the contract review process?
So that's being created at this point, or at least reviewed and defined. And Beth could probably talk more about what our current process is. But one of the elements that this A3 wanted to address is making sure that compliance was plugged in to a natural flow of where those steps take place. So it has not been defined and plugged in yet as a deliberate step to the level that the compliance really should have you into these contracts.
Chair, just, my view of risk in healthcare is you have 3 basic big risks: billing, physician contract, and I do believe a hidden risk that most people don't really identify is whether or not your IT systems are reliable. So what I asked on physician contracts, that they do have a process to look at fair market, but I wanted to make sure that we had a written process. What do we actually do in terms of a practice? So every time we review a physician contract, we absolutely know that we've gone through the process and that it's within boundaries. If it's outside of boundaries, then it needs an additional step. So that's what I've asked in terms of adding to what we already do. And I've looked at least 1 or 2 contracts. The physician contracts are reviewed for fair market value. There is a sign-off process. Attached to the contract typically is the fair market value that uses MGMA standards. What I'd like is a little bit more robust. This is our process. This is our checklist, and it's all been signed off so that we feel comfortable. You're not required to get an outside review of a physician contract or fair market value, but you do need a process, and that's what I want better defined. They have a process, and they've been following it, but it's not as written as. So that's something that
That's because historically, there were very few contracts that were written. There was just the hospital pathologist that ran the lab, but all of our anesthesiologists lived here, and it was understood that they were always supposed to be work, but they didn't have a contract. It was just like me. You show up and you do your work. But that is changing dramatically as employed physicians, and so this process needs to happen. It's the future.
And it doesn't have to be onerous, but it has to be justified.
It has to be labeled, yeah.
Please.
Can you change to the next page, Sharon? So this is a rough spreadsheet that Beth started working on for us, pulling out of all of our contracts. So you can see the volume of contracts and what we're starting to do with the physician contract group is really lump our contracts by group, and you can kind of see how many we're looking at. So we have our hospitalist group, our general surgeon, our medical directorship, on-call agreements, behavioral health, oncology, other specialties, and then some of our recruitment agreements. So we're starting to look at our volume of contracts, when our renewal dates are, looking at it, and then looking at our fair market range for those groups and moving forward on them. So this is something that we're just starting to develop out so that way we can present it to the compliance committee and show where we are, we're doing as our due diligence and where all of our physician contracts are falling, and making sure that you're aware that we are doing our due diligence on it. The other thing that Beth is working on right now is we do have a robust policy on how we assess our fair market value. We've sent it off to Hal Render to give us guidance and look at it. And she's been working on that to make sure our policy and how we're doing it is up to current standards. And Hal Render has been giving us feedback on that and looking at it, because it's been just a couple years since we've had that looked at now. So Beth has been working on that for us also. We had another policy that we were hoping to get to you this month, but it'll probably be at our next compliance meeting. We're working on our physician recruitment policy to bring to the board, because the board used to have a physician recruitment committee that it's really no longer meeting. And there was a lot of elements in that policy of looking at that committee and our community needs assessment. So we're redoing that policy and going to present that to this committee to look at with no ands, ors, or shoulds in it. And have that reviewed. I mean, again, laugh, that's great. And have that reviewed by this committee to make sure that we are meeting the standards for the board. So that hopefully will be at the next meeting.
It's historical perspective again.
Yeah.
I was on that committee, and talking about hospital employees going from 450 to 700, all of that information was distilled down by Kathy Callahan, one person. Knew
Yes.
everything about start, take back, and if Kathy said you could do it, you could do it. So she assessed data such as how many physicians are recommended from general data per X thousand people, how much you could offer them and things like that. And so now that she's been gone and our contracts are now increasing so substantially, we need to really have a robust.
And she knew when they were going to retire and how long. Yes.
And so this committee was a way it was a board committee, as I recall, with hospital representation, and the general populace could then go through the board members and through the physicians to say, hey, could you look at oncology? Could you look at gynecology? Could you look here? But that was disbanded maybe 2 years ago. 2 years ago.
Through the chair, I'd just like to point out, I know we're talking a lot about fair market value as being one of the important pieces of compliance. And I'll echo what Ian was saying about being able to review those. However, there are certain elements of these physician contracts that aren't being reviewed. And so those would also be part of this checklist, not just to make sure that we've got fair market value down, but for instance, familial relationships with other contracts. Those are things that the government wants you to look at as well, because you could be hiding the way that you're kicking back or overpaying a physician through, and it listed in code, either a mother or a father or brother, sister, aunt, uncle, and so on. So those also need to be reviewed too for other contracts, like your water, for instance. You could have a physician who has a sister who owns a water contract, and you're now paying them $1 million for something that's probably worth $30,000 a year. And the idea from the government's perspective is you're overpaying that physician by paying someone else who's then rubbing the back of the physician. So there's a lot to these contracts that need to be reviewed more than just fair market.
Okay, is there anything more to say about that? Okay, what do we have next? Don't we have executive session? Yes. Executive session, would somebody, we have the wording for the executive session, motion. Somebody like to offer that as a motion?
I have it. I move the Board Compliance and Audit Committee of Bartlett Regional Hospital recess into executive session to discuss matters by which law, municipal charter, or ordinance are required to be confidential or involve consideration of records that are not subject to public disclosure, specifically the discussion of items that are protected by attorney-client privilege.
Or these?
Please stop recording. Thank you.
What else is going on?
I don't think
Recording is started.
Okay. We probably don't need any motion describing what we discussed.
Okay. So you can adjourn meeting for Sharon.
Is there anything, does anybody have anything else they want to say? Or I guess, or in other words, let's just assume our committee comments and questions. Okay, then Mike, any comment I would make would have to do with the weather outside. So let's consider ourselves adjourned. 37.
So let it be said.
Raising the glasses in the person.
I wasn't, we're shaking.
Oh, I was